Can we, by any chance, can we prevent epilepsy?
Yeah, this is a very important question, especially in our country. Because if you look at the Western countries versus developing countries, the causes of epilepsy are definitely different. In children, the most important preventable cause of epilepsy is hypoxic ischemic damage. Because at the time of delivery, by taking a good precaution, that is with good antenatal checkups and delivery in a good hospital with the backup of a pediatrician, if a delivery is done, most of the times we can prevent this hypoxic ischemic encephalopathy, which is an important cause for developmental delay as well as seizures. The second important cause of preventable epilepsy is head injuries. So head injuries can be prevented by just following simple rules like wearing a helmet when you are driving, wearing a seat belt when you are driving the car, but most of the times we just take as if nothing, we don't take these precautions. So by this, even if you are involved in an accident, you will not end up having a head injury, because it is not just treating the head injury, it has long-term implications. So it's important to prevent seizures following a head injury, and also by following good traffic rules, so that we can reduce the number of the accidents. Not only that, in our country it is very important to prevent infections, especially a condition like cysticercosis. Cysticercosis is nothing but you have worms in your intestines, and the larvae will go through the circulation into the brain and sit in one area of the brain, and they cause seizures. And normally the larva may die within a period of few days to weeks, but when it is dying, it leads to lot of destruction in the area, and this leads to so-called calcification or gliosis, which itself is a focus for occurrence of seizures. And so this is a very important preventable cause of epilepsy, because when it is acute we call it as a seizure, but when it leads to gliosis and calcification, then we call it as epilepsy. Here the treatment is almost continuous, possibly lifelong once you have this. So to prevent this, just simple precaution of washing the hands before eating. So this should be done routinely by every child, because most of the children with partial seizures have cysticercosis, especially in the coastal areas of Andhra Pradesh. So by following these simple rules, so that parents should insist and teachers also should train the children in the schools, just before eating, you please wash your hands and legs well, and then so that you don't disseminate the infection also, and also you take care of yourself. So these are the three important causes of preventable epilepsies.